Well, we need to make a quick change here in the chair while we get ready for our next guest. I want to remind you you're watching Health This Week. For more information, go to our website, healththisweek.com. And we have a quick change here, Dr. Sheila Foreman. Sheila, it's always great to see you.
Thanks, Don. Happy to be here.
Well, of course, Sheila, you're a great friend of the program, clinical psychologist. You're always helping people, as we like to say, cope with life. And I wanted to talk to you about the situation that occurs in life when a loved one or a very good friend, a family member, lets you know that they've had a serious illness diagnosis. That can be devastating to you,
Absolutely.
Even though they're the ones going through the illness.
That's right. Most of the time we think that it's the patient who's suffering when there's a serious diagnosis, and of course they are suffering, but so are their family and friends.
The first thing that came to my mind was there's two aspects of thought here. What can you say, and what should you not say? I mean, is there a general rule of thumb?
Are you saying what should I say to my friend who's disclosed that she's ill?
Exactly.
Okay. A lot of it depends on my friend. Some people are very open. They want to talk about it. They embrace it. They're conversant about it. Other people don't want to talk about it. So the first thing is know who your friend is, what he or she is comfortable with, and then also know yourself. What are you comfortable with? How comfortable are you sharing either your thoughts or your feelings? Maybe you have some grief and sadness and fear. Do you want to share that with a friend? So much of it depends on what they can handle as well.
Because the first thing that comes to my mind is if I'm feeling grief and sadness, do I want to push that on to the friend who's already dealing with this illness, or a member of your family and that kind of thing, as opposed to being a cheerleader and being real positive and you're going to get through this and I'm going to do anything I can to help you? I would think that would be so much better than, oh, I'm really sorry to hear that you have this.
Yeah, I think we have to actually meet in the middle. Okay. To be the Pollyannish cheerleader, oftentimes that's not what the seriously ill person needs to hear.
Okay.
They want to know that they're cared about, that they're listened to, that they're valued. But you also don't want to dump your emotional stress on them, because that will just complicate their treatment. So I recommend for people, share your thoughts and feelings with your loved one, but then find somebody else or perhaps a group where you can really talk about what's going on. You don't want to burden your loved one with all of that.
So there are actually groups and organizations that are involved in helping family members cope with the disease of their other family members.
Absolutely. All the major diseases have associations. Through all these associations, you can find local groups that will support family members and loved ones. Also, your doctor or social worker associated with the case can also direct you to either private practice people or mass organizations.
I would imagine, Sheila, that it's really all about communication. You need to communicate your feelings to your loved one, but at the same time, you need to continually stay in contact with them just to let them know that you're there for them, correct? Of
course, especially if they don't live nearby. It's one thing if the family member is in your home. It's another thing if they're across the country. But we've got email, we've got cell phones, we've got regular phones. Stay in touch with them, let them know that you're there, and really listen. Make sure that they know that they can talk to you about what's going on with them also.
Now, I know that many times in your practice you're actually talking to the patients themselves. What are the patients telling you about their family members that are trying to cope with the disease that they have?
That's really where my answers were coming from, is from what I learned from my patients. Either, I wish she would stop telling me everything's going to be okay when I know it's not.
I see.
Or, I wish she'd stop crying and let me get on with my life. So really, it's any extreme expression of emotion that's not appropriate to the circumstance needs to be nixed.
So really, the loved one going through the disease really like to see some sense of balance.
Absolutely. That's right. It's a perfect word, balance.
Excellent advice. Once again, Dr. Sheila Foreman. For more information about Sheila, go to her website, drsheilafforeman.com. Sheila, thanks so much. Great advice.
Thanks for having me.